Prairie Mountain Health is pleased to highlight some of our key accomplishments and challenges from the past fiscal year, our 7th year in operations. Our journey forward continues to present opportunities to enhancing our programs and services by researching and implementing innovative ways to deliver care and striving for better outcomes for the patients, clients, and residents we serve. The 2018-2019 year marked the 3rd year of working within the 5-year PMH strategic plan, which is in effect until March 31st, 2021. Every 5 years, health authorities review and revise their strategic plan in response to trends in demographics, health status, and health service use, as well as provincial government priorities. Our annual report describes actions and operations from the strategic plan priorities for April 1st, 2018 to March 31st, 2019. There are 6 strategic priorities adopted by PMH. They are aligned with those of the province of Manitoba. How is Prairie Mountain Health working toward these priorities? Let's go through some actions, initiatives, successes, and challenges associated with each. PMH partners with communities, organizations, and stakeholders to continue addressing social determinants of health and related inequities.
Sexually transmitted and bloodborne infections, STVBI.
Early detection is important to reduce the negative impact of this infection. PMH has further developed the STBBI program to enhance public awareness and access to STBBI testing. PMH Public Health and Medical Officers of Health are currently coordinating associated strategies to reduce the alarming increases, including the infections of gonorrhea, chlamydia, and syphilis, hepatitis B, hepatitis C, and HIV.
Primary care outreach clinics.
The Dauphin Clinic began operations in May 2018, 1 day per week. The clinic in the Dauphin Community Health Services building was modeled after Swan River's Clinic, which is held at the Swan Valley Primary Care Center. Clients may visit the clinic with a number of different circumstances, including substance abuse, addressing infections, wound care, housing insecurity, and socioeconomic disadvantage. Support can be provided by a community health nurse, physicians with training in addictions medicine, infectious disease specialists in Winnipeg, AFM counselor, or a community mental health worker.
Headstrong Anti-Stigma Summit.
PMH is committed to the reduction of stigma related to mental health problems. Stigma is keeping many people from seeking the help they need when they need it most. In collaboration with our child and adolescent mental health services, suicide prevention committees, and community partners, over 200 youth and teachers attended our Headstrong Stomp Out Stigma Summits in early 2019. School teams have been active in their communities, implementing what they learned from the summit. We know people are our most valuable asset. We remain committed to establishing a sustainable workforce that meets current and future needs within the health region. We also continue to look at ways of creating a positive and safe work environment.
Physician recruitment initiatives.
Physician recruitment efforts continued to be successful last year. There were 17 new physicians, specialists, and 1 new physician assistant providing care to PMH residents. PMH continues to partner with the University of Manitoba, Max Rady College of Medicine, the Manitoba Healthcare Providers Network, and communities on a variety of recruitment initiatives geared towards Manitoba students and residents.
Rural BPIEN Registered Nurse Initiative, Bridging Program for Internationally Trained Nurses.
This initiative continued in 2018-2019. While there continues to be staff vacancies, success has been achieved in the BPIEN initiative, with 20 students successfully completing the program and 18 registered nurses gaining employment throughout the region.
Employee wellness.
The Employee Wellness Committee is committed to promoting health and wellness for PMH employees. Some of the wellness promotions this fiscal year included Family Fun Day at Assisipi Ski Hill, helping yourself and others in the workplace, and PMH Virtue Pledges. Continuing to develop regional strategies and processes to help contribute to health system sustainability.
Telehealth.
Access to Manitoba Telehealth continued to mean less travel for patients, more access to medical specialists, and overall, better healthcare services closer to home for our regional residents. These 4 sites are among the top 10 most utilized rural sites. Dauphin Regional Health Centre was the most utilized rural site for all of Manitoba Telehealth. As you can see, oncology continues to be the most utilized specialty service.
Brandon Regional Health Centre Redevelopment Project.
The last phase of the $16 million project commenced in early 2018 with renovations to the 4th floor medical unit. The overall project, which started in May 2016, called for over 53,000 square feet of redevelopment, which included the pediatric and acute medical areas. With all phases now completed, 12 new medical inpatient rooms are available, as well as expanded areas for patients, staff, and family support.
Dauphin Regional Health Centre.
The $23 million project called for 16,000 square feet of new and renovated area for the emergency department, 3 times the space that was previously in use. Enhanced treatment, examination, and observation rooms have increased efficiency in patient flow and workflow within the new ED, which opened in late July of this year. Additionally, a renovated back entrance to the hospital allows for better access for those with mobility challenges or disabilities. One more phase remains. It involves demolition and reconstruction of the entire front entrance to be completed by mid-November 2019. Facilitating client-centered flow through the entire healthcare system and reducing barriers to access are key objectives towards improving access to care.
Rapid access to addiction medicine.
The use of alcohol, opioids, crystal methamphetamine, and related impacts the lives of individuals, families, and communities, and has been a growing concern in PMH and across the province. In response, the Brandon RAAM Clinic opened in October 2018 at the 7th Street Health Access Center. This initiative is supported by My Health Team Brandon and the Addictions Foundation of Manitoba, AFM.
The Brandon RAM Clinic is a low barrier, easy access clinic for people who are struggling with substance abuse and are wanting to either decrease the harm or look at abstinence as a possible future option. Substances that we're seeing is mostly opiates and methamphetamines, although we do see some alcohol, but we're also seeing benzodiazepine and marijuana, as well as whether they're primary, secondary, or tertiary substance of abuse. So when we do our assessments, we're looking at all substances, and the majority of people that we see are poly-addicted. Our RAM clinics are staffed by an addiction medicine specialist who is Dr. Tatanini, and who also happens to be a psychiatrist, which is helpful since a large portion of clients living with substance use disorders are also living with significant mental health issues. In addition to the addressing the substance need, the nurse and the AFM counselor are able to provide counseling, hook them up with other resources. The benefit for this RAM clinic being located at the 7th Street Health Access Center is that we've got other social resources at our fingertips. So if housing is an issue, we can hook them up with a housing coordinator. If they're looking for be able to get benefits, we can hook them up with a navigator to help them access other benefits that they may have.
Mobile clinic.
PMH reached a 5-year milestone with the mobile clinic. The mobile clinic offers primary care services to several rural communities, including 4 First Nation communities, Birdtail Sioux First Nation, Ebb and Flow First Nation, Kisikuinan First Nation, and Ochi-Chakosipi First Nation.
Brandon Dialysis Services.
Brandon Dialysis Service expansion was unveiled in December 2018, launching new options for Westman residents living with kidney failure. This will make home dialysis training and ongoing support more accessible for patients in the region. The home peritoneal dialysis program, which launched in the fall of 2018, will allow for more independence, less travel, fewer hospitalizations, less exposure to infection, and fewer dietary restrictions.
Dauphin MRI.
The Dauphin MRI unit began operations in November of 2018. Adding a second MRI unit to the PMH region will reduce patient wait times and the amount of travel for residents residing in the northern portion of the region. The machine is projected to perform about 3,500 scans annually. We remain committed to advancing a culture of quality improvement within the region with a focus on planning that is also based on innovation, evidence, and best practices.
Provincial Innovation Recognition.
The Planning and Innovation team received provincial recognition in the fall for their work in 5S and inventory management across PMH. Through this lean initiative, the project team identified efficiencies by assessing supply ordering patterns and variances in inventories throughout the region. Over $700,000 in cost saving was achieved in the region's acute and long-term care facilities.
MIPS Patient Safety Initiative Grant.
According to the 2015 Community Health Assessment, PMH had the highest rate in Manitoba of benzodiazepine use among residents aged 75 and over in long-term care.
So hello, my name is Dr. Elizabeth Reinold, and I'm a geriatrician here in Prairie Mountain Health. And I'm just going to take a little bit of time to tell you about an exciting project that has been underway for just about a year. And it's housed under the Falls Steering Team and is called the PMH Sedative Deprescribing Initiative. So about a year ago, the Falls Steering Team agreed that high-risk medications was a priority, and I had been attending some geriatrics meetings where new resources and new evidence for the importance of deprescribing sedative hypnotics or sleeping pills was a priority. So I brought to the Falls Steering Team some new resources for patient and family education, this handout in particular, which has a good evidence base. And we decided to have a working group about how to spread this information through the region. We applied for and got the Dr. John Wade Patient Safety Innovation Grant from the Manitoba Institute for Patient Safety. And this was really the start or the little push we needed to get this initiative off the ground. We were able to make copies to provide to all kinds of providers throughout Prairie Mountain Health, including physicians in private clinics and everybody within PMH. But then the real work came from trying to get this information out and realizing that there was a lot of education that was needed. And Prairie Mountain Health is the kind of place where you can know the right people or bring the right people into the same room or into a Skype meeting, and we have had a number of working groups spin off from this, and we now have what's coming together as a more regional approach to education about the importance of deprescribing sedative hypnotics and decreasing the risks, and also the awareness about how to promote healthy sleep. And really it all got started because of a brochure and a little bit of money to get us started making those connections, and now we're really seeing the impact throughout the region, and it's going to be a great benefit to our entire region and the communities within our region.
COPD System of Care.
PMH, along with Winnipeg and Interlake Eastern RHAs, is one of 6 sites across Canada to participate in a national initiative to improve the care for people living with chronic obstructive pulmonary disease, COPD. The goal is to improve the experience of those living with COPD through patient engagement, self-management, skill development, and enhanced integration and transitions between hospital and home. PMH remains committed to putting patients first by providing quality patient and family-centered care. This includes improving client safety throughout the region.
Nurse practitioners.
PMH continues to improve access to primary care services and have expanded the number of nurse practitioners, NPs, in the region. As of March 2019, there were 20 NPs providing service to 27 PMH communities, including 10 First Nation communities.
A nurse practitioner can diagnose, they can prescribe, they can order laboratory tests and follow up with them, and we can refer to specialists. The other thing that often we can do is do minor surgical procedures.
Cirrus PCH.
Cirrus PCH was the first in the region to complete the home decorative project, and several other regional care homes were either looking into the concept or moving forward with similar designs in 2019-2020. In Cirrus, the objective was to fill each wall with large, beautiful prints of scenes that sparked a memory or feeling of joy. Incorporating sensory items throughout the care home stimulated not just the eyes, but ears, sense of touch, perhaps even smell, which gives residents a sense of home instead of just personal care. As you can appreciate, not every person's contribution or program and service contribution has been represented in our recap today. However, we recognize that every success of the organization is due to everyone's effort, a team effort. Healthcare, as we have known it in Manitoba, continues to change and evolve. Health system transformation will ensure consistent, quality healthcare is available to all Manitobans within a system that is safe, reliable, and sustainable in the long term. Although some of these changes take time, a tremendous opportunity remains to refocus our system and better meet the needs of all Manitobans. PMH continues to be involved in and support the health system transformation process. Staff from across PMH have provided input into Manitoba's first clinical and preventative services plan through participation on clinical teams or providing feedback through staff engagement opportunities. A number of PMH staff share their talents with the Transformation Management Office on a daily basis through secondments supported by PMH or with regular membership on provincial planning committees. Prairie Mountain Health looks forward to the journey ahead and will continue to provide support, resources, and expertise throughout this time of transformation. The PMH Board of Directors and Executive Management Team thank our staff, our affiliate staff, health partners and stakeholders, physicians and volunteers for contributions made every day to ensure the best possible care and services provided within the health region. We continue working towards our vision of health and wellness for all.